Composition: Fusil 2% weight by weight cream. Each gram contains fusidic acid 20 mg/bp. Specification: Fusil 2% weight by weight ointment. Each gram contains sodium fusidate 20 mg/bp. Specification. Indications: Fusil cream. Fusil ointment cream is indicated either alone or in combination with systemic therapy in the treatment of primary and secondary skin infections caused by a sensitive strain of Staphylococcus aureus, Streptococcus species, and Corynebacterium monocysimum. Primary skin infections that may be expected to respond to treatment with fusidic acid applied topically include impetigo contagiosa superficial folliculitis, psychosis barbae, parenchyma, and erythema. Also, such secondary infections as infected eczematoid dermatitis, infected contact dermatitis, and infected cuts abrasions. Dosage and administration: adults and pediatric population. Uncovered lesions apply gently 3 or 4 times daily, while covered lesions less frequent applications may be adequate. Method of administration is cutaneous use. Interaction with other medicinal products and other forms of interaction. No interaction studies have been performed. Interactions with systemically administered medicinal products are considered minimal as the systemic absorption or topical fusidic acid sodium fusidate is negligible. Fertility, pregnancy, and lactation. So, the pregnancy, no effects during pregnancy are anticipated since systemic exposure to topically applied fusidic acid sodium fusidate is negligible. Topical fusidic acid sodium fusidate can be used during pregnancy. Now, breastfeeding. No effects on the breastfeed newborn infant are anticipated since a systemic exposure or typically applied fusidic acid sodium fusidate to the breastfeeding woman is negligible. Topical fusidic acid sodium fusidate can be used during breastfeeding, but it is recommended to avoid applying topical fusidic acid sodium fusidate on the breast. Now, fertility. There are no clinical studies with topical fusidic acid regarding fertility. No effects in women of childbearing potential are anticipated since systemic exposure following topically applied fusidic acid is negligible. Effects on ability to drive and use machines. Fusidic acid sodium fusidate administered topically has no or negligible influence on the ability to drive and use machines. Undesirable effects. The estimation of the frequency of undesirable effects is based on pooled analysis of data from clinical trials and from spontaneous reporting. Based on pooled data from clinical studies including 474 patients who received fusidic cream or sodium fusidate ointment, the frequency of undesirable effects is 2.3%. The most frequently reported adverse reactions during treatment are various skin reactions such as pruritus and rash, followed by application site conditions such as pain and irritation, with all occurred in less than 1% patients. Hypersensitivity and angioedema have been reported. Immune system disorders, hypersensitivity, eye disorders like conjunctivitis, skin and subcutaneous tissue disorders, dermatitis including dermatitis contact, eczema, rash, various types of rash reactions such as erythematous, pustular, vesicular, macular, papular, and papular have been reported. Rash generalized has also occurred. Pruritus, erythema, general disorders, and administration site conditions. Application site pain, including skin burning sensation, application site irritation, pediatric population, frequency, type, and severity of adverse reactions in children are expected to be same in adults. Overdose. Overdose is unlikely to occur unless hypersensitivity to fusidic acid or any of the excipients exists. Accidental ingestion of fusidic acid cream, sodium fusidate ointment is unlikely to cause any harm. The total quantity of 30-gram fusidic acid cream sodium fusidate ointment contains 600 mg fusidic acid will usually not exceed the approved total daily oral dose of fusidic acid containing products except in children aged less than 1 year and weighing less than 10 kg. Although in this instance a child of this particular age group is unlikely to ingest a whole tube of fusidic acid cream or sodium fusidate ointment, the concentration of the excipient is too low to constitute a safety risk. Presentation: Fusil 2% weight by weight cream tubes of 5 gram and 15 gram, while Fusil 2% weight by weight ointment tube of 5 gram and 15 gram. Instructions: to be sold only on the prescription of a registered medical practitioner. Store below 25 degrees centigrade. Protect from sunlight. Keep all medicines out of reach of the children. Keep for external use only, and the dosage is as directed by the physician. The manufactured by